Case two. So we had a lady come in this morning and she was complaining of whenever she eats something on the right, when she bites and then when she opens it's sensitive. So I know you guys are probably thinking already, yeah, crack. So she had a crack in this tooth. I knew it as soon as she was saying it, this is going to be a crack. So I listened to her and she was like, everything else is fine. And I just want to know what's going on here. So we did a checkup for her anyway, did a full checkup. She's, you know, a lovely patient of mine. And I took an x-ray of this just to make sure. Obviously we know when it's a crack there might be an infection, and if there's, you know, infection we might need to do a root canal, but actually there was no infection. And this is the tooth, and you can see why I love my new camera. It's like HD. I just put it on the screen like this and her face was just like, oh. And I was like, you can see here you've got an old silver filling. And she was like, oh, is it cracked? And I was like, well, yeah, you've actually got a little crack here and little cracks here. And then she's just looking at me and I said, well, you have a silver filling in there. So what do silver fillings do? They're made of metal. Whenever you have something hot and cold, they will expand and contract, but your tooth won't expand and contract as much as metal. And she went, oh. So she goes, it's forcing my tooth. I said, exactly. So what's happening is it's expanding and your tooth is going, oh, and then it's contracting and then your tooth is kind of relaxing, but it's just doing that. Imagine over how many years. So you're getting these cracks forming in your tooth. And you can see that the filling is starting to come away from the edges and you've lost some here. And she went, ah. And I said, what can happen is bacteria can then get into these cracks. And then I explained to her, like, this is a black and white image of your tooth. And they can go through the cracks into the center of the tooth. This is the enamel, this white blob here is your filling. This is the soft bit, this is the dentine where the nerves are kind of coming into. And this is the pulp, which is the nerve, the heart of the tooth. So if the bacteria comes through this, there's little tubes, and it can go straight into the nerve. And if it goes into the nerve, that's when we get root canal. That's when we get extractions, because that's when the heart is dead. And she was like, ah. I said, right now, your symptoms aren't of that, of a dying tooth. So that's good. But the fact that you're getting symptoms, it means it's close. It's getting irritated. So what we need to do is remove this filling, see how big the crack is and where the cracks are, because remember, it's a metal filling. I can't actually fully see around it until I get eyes on it. And then I need to remove the cracks, any decay, make sure it's healthy, and then I would suggest a crown. She went, okay, that makes sense. Now she had an old metal crown here, and I said, do you have a preference on the type of crown, metal or white? And she was like, probably white because it doesn't look very nice, but what would you advise? I said, personally, if you're happy with my recommendation, white crown. And I said, the reason being is because then I don't have to actually do a full crown. I can just go down the edges, remove the cracks, take out the old filling, make sure there's no more kind of decay in there, seal it up with a nice filling. So I'm disinfecting it, layering it beautifully so it looks gorgeous. So I said, to me it will, for you it's just a tooth. And then she smiled. And then I said, what we'll do is we'll take impressions of it and get a really nice custom strong crown on there. And what that will do is hold everything together and stop it from worsening. But just remember, 1 in 5 teeth can still die after having a crown done. And she went, ah. I said, but if we don't do it, it will definitely happen because that bacteria will get into the nerve. So we're reducing the odds, but not fully eliminating it. I said, there's not, can't guarantee everything. And she's like, no, I understand, that makes sense. And I said, these days, even my phone dies after a year. And she laughed, she was like, yeah. And I said, this filling's on you good time, but let's get a crown on there to make sure we can extend the life of this tooth. I said, once you get a filling in there, it's just a cycle of trying to maintain the tooth for as long as possible before we get implants. And she was like, yeah, because she's had some 2 beautiful implants by my implantologist, which I showed her. By the way, you should do this. If a patient has dental work by yourself or colleagues in the practice, always compliment it if it's good. So I actually showed her, so you've had beautiful implants. And she's like, yeah, the dentist here did it. And I said, yeah, they're gorgeous and they're healthy and everything's looking good in the mouth. But that makes them feel reassured that where they're coming, the clinicians are good, the work quality is good, and when you compliment each other, it's nice. It's a good ethos in the practice. If they were crap, obviously I wouldn't do that. And then I showed her other teeth. So I said to her, okay, I know this is your concern, but we do have other things happening. And then I let the pictures, now I've educated her, I've explained to her the concept of metal fillings, cracks, what to look for. I just pulled up another picture. And I said, that's your top. And she was like, that looks worse. And I was like, yeah, it does. But the symptoms are coming from the bottom. So we checked it and everything. So I knew it was coming from the bottom. And I said, but it won't be long before probably this will be doing the same thing. She's like, let's just crown it. And I said, yes, we can do. But I said, I'm a bit more of the ethos of, because you've got a lot going on in the mouth and this one's got symptoms, let's fix this. Let's give it 4 weeks and everything's okay, then we can do the next one. And then she smiled and she goes, I like you. She was like, I would have thought you just want to do everything. And I was like, you know me, Claire, I'm not like that. And she's like, yeah. But I think that's an important thing to know. Like, I'm not trying to rush all these crowns, Emaxes in her mouth. For her, it is beneficial if I do one, see what happens to the tooth, let the symptoms settle. It's all good. Then we move to the next. And it's not just this tooth. Then I pulled up another picture and she went, oh God, it's all of them, isn't it? I said, not all of them, but you can see. And she's like, yeah, it's just coming away from the tooth. And I said, yeah. I said, maybe on this back one, I could get away with a filling. Mid-term, maybe for a few years, but long-term, you'll probably need some sort of crown. And not a full one, not like the traditional type like you had on the other tooth, but like a helmet. And then I have my model. And I did show her. This wasn't this model, but I will show you. I'll show you my fake version. This wasn't this model, but I had, I think Ahmed's got it next door, but I had an actual prep. So you can buy these models, by the way. My teeth! The kids keep pulling the teeth off. So I bought this from Wish, but you can literally just prep it. Sad times. This is a metal one, I'll show you. So I literally just onlay prepped it and gave my model to the lab, and they made me a metal onlay for it. But you can do, the model that Ahmed's got next door has an Emax onlay prep, but then I have two next to each other. So you can do that. Just get a model, prep it, send it to your lab, and get a metal crown and a Emax onlay next to each other if you want. Pulverize with some extractions. Oh. I'll sort it out later. This 4 is missing too. Sad times. I even have this actually. There was just like a tray if you want to show people the difference between metal and white. The more props you have, the better that patients can see it. I prefer it on the model though, but I think that really helps in educating our patients on what things will look visually. And having a camera for me is just a no-brainer. She herself was just like, look at that. And then I could explain to her, like, can you see how this is thinner here? By the time I finish cleaning this, it's going to be really thin. And I could fill it with a filling, but one day you'll be biting into something and the wall will snap off. And she was like, yes. And even though she didn't ask me that, and you're probably thinking, isn't that information overload? It isn't, because I don't want her to go home and think the dentist is just going to take out a silver filling and crown it because it's expensive. It's $750 versus a filling which could be $250, $350. So I don't want her to go home with those questions, because I know what she's thinking. Why can't I just take a filling out and put a filling in? So I explained to her what would happen if I just took this out and put a white filling. So I said to her, this one definitely is very thin, and our marker tends to be 2 millimeters. And I said to her, this is zoomed in, it's massive. I said, your tooth is this big? And she went, ah, yes. And when I said that, I could see she was actually probably thinking, why can't she just put a filling in there? And I said, your tooth is this thin. So this is actually about 0.5 millimeters. And she went, okay. So I said, this will snap. And that's not what I want. I don't want to do work for you and charge you and find that it's not going to work for you. And she was like, yeah. And I said, here, again, an onlay would be good, but this looks thicker. So I won't fully know till I take it out, but I think we could get away with a filling in there, buy you some time till maybe a crown is something we need to do. And she was like, yeah, whatever you suggest, actually, if you want 3 crowns, let's do them. And she trusted me because I gave her the information. I showed her what was in her mouth, and I gave her the knowledge to agree with my, what she would call maybe authority or information or knowledge, whatever it is. But that was an interesting case from today as well. If Lou Salek was here this morning to film it.